Okay, hello everyone. Welcome to our webinar on coping with COVID and coronavirus in individuals with anxiety. So this is a webinar that's more geared towards individuals who've struggled with anxiety in the past, but probably will be useful for anyone experiencing increased distress or any increase in mental health symptoms in this time. So during this webinar, we hope to just provide some information for you about why this current situation is really a perfect storm for anxiety or distress in general. And the idea is when we're experiencing a lot of distress, it can be helpful to understand what's causing it or what are the different elements. So when we're experiencing a lot of distress and we don't know maybe why we're having that reaction, it can be a lot harder to cope with. So we want to help you try to understand why this is really fueling anxiety, or why the situation can very easily fuel anxiety. And then in the second part, kind of talk about some tips or principles that might be helpful in coping. So we'll introduce ourselves. So we are three therapists from Portland Psychotherapy here in Portland, Oregon. My name is Dr. Brian Pilecki. I am a clinical psychologist who specializes in the treatment of anxiety disorders, OCD, generalized anxiety, panic, trauma, PTSD. Joanne, would you like to introduce yourself?
Sure. I'm Dr. Joanne Chan. I'm also a psychologist at Portland Psychotherapy, specializing in anxiety disorders and obsessive and compulsive related disorders, using evidence-based treatment. And so we do a lot of exposure therapy at our clinic and do a lot of active work. All right, Juliana.
Hi, I'm Dr. Juliana Sapienza, and I'm another psychologist at Portland Psychotherapy. I also specialize in treating anxiety disorders, but my focus is really on working with children and adolescents and their parents. So that's kind of my focus in the clinic.
Great. So we'll talk first about why this situation is maybe creating so much anxiety. And so the first and probably most obvious thing is it's adding new stressors that weren't there to begin with. So some of us might have a loved one who is sick, or we might have a loss of income. So some of us have these very significant stressors that have just showed up that now we have to figure out how to handle and how to cope with. But even in the absence of a clear something that is difficult, a challenge, a problem, we might be experiencing a lot of anxiety, a lot of distress. And so we want to just help kind of understand maybe some of the different reasons. So I'll start by talking about the fact that this situation involves a lot of change all at once that we didn't really plan for, we didn't really anticipate. All of a sudden, we kind of found ourselves in this brand new situation. Many of us are now working at home who didn't work at home before, so we have to establish new routines or new habits. Our lifestyles changed probably pretty dramatically. And so change is hard to adjust to. I know for myself, it took me a few days to realize this. Someone had mentioned actually that this is a lot of change. And I said, oh yeah, it's why it's hard to adjust to this new schedule. And it just feels so overwhelming because it just feels so much different than my normal life. So another reason that this situation provokes a lot of it, or can provoke a lot of anxiety, is uncertainty. So would one of you like to explain why about uncertainty?
Yeah, I can talk a little bit about that. So, I mean, uncertainty is something that we all have trouble with, not knowing what's going to happen. In the work that I do, a lot of people have uncertainty, have problems tolerating uncertainty around like whether something bad's going to happen, whether they're going to get sick, whether they're going to lose their job, or and so all of that right now is coming up in our society, because actually a lot of people are losing their jobs, and their financial situations are more unstable, and people are getting sick, and there's a lot of uncertainty around what measures we need to take to protect ourselves, because it seems like we're getting different messages every day about that. So I think that uncertainty is really heightened right now, and like the same time, a lot of difficult things are happening in people's lives that combination is just really hard to tolerate. So I think it's just a bigger animal right now for people to have to hold and tolerate. So
yeah, I think another really big part of that uncertainty, at least for me, is just this this big question of like, how long is this going to last, right?
mm-hmm.
And there's so many different predictions out there about what life is going to look like in a few months or a few weeks. And I find myself kind of constantly checking, like, oh, tonight there's going to be an answer about how long this is going to last. And I think that's a really, for people who had lots of plans for their future about even, small things like vacations, bigger things like we were going to buy a house this year, all those kinds of things are now really up in the air.
Mm-hmm.
Yeah, and sort of anxiety, the job of anxiety is to kind of anticipate what's going to happen and fill in the blanks. And our minds want to know. Our minds want to know that we're going to be safe and secure, and our minds want to predict. And so when there's such a big unknown in this situation, the mind just kind of goes into, or can go into like overdrive, kind of like imagining all the different scenarios that could play out. And it's just really hard for us to tolerate not knowing if this could be a couple of weeks or a couple of months or longer.
Mm-hmm.
So Joanne, you sort of mentioned the large amount of information. This is another element that is really can be really challenging in that there is just so much information in news, social media. How do we deal with that? How can folks best be prepared or best approach that aspect of the situation?
Yeah, that's a good question. I think that it's really hard to know exactly who to listen to and what to do. There's the CDC, there's the WHO, there's our government, there are the health professionals, and they're often not always saying the same thing. So I think that the problem is like filtering, the information and taking the stuff that you feel is most reasonable and believable, I guess. For myself, I find that it's really important for me to go to like the people who have the evidence base and who are experts in the field. So, like physicians, people who specialize in infectious diseases, and kind of going to their specific websites. Like Dr. Fauci has been doing a lot of interviews, so I've been listening to him, and other physicians that are talking about it too. So that's been where I've been getting most of my information, but and trying to kind of resist like taking in a lot of other sources, because it can get confusing. Mm-hmm.
Yeah, I think limiting how much you're doing of that in a day is also really important. Just how much time you're spending looking at the news, looking at these different videos, because you certainly could find yourself spending all day looking at that stuff, because there is so much information out there. And so, anything from sort of just being aware to, if you really are finding yourself kind of looking at the news all the time, maybe setting aside a time, a specific amount of time and a specific time that you're going to look at the news, and then, limit it after that. And, once you're done, doing something that absorbs your attention in another way, because I think it's just so much. I think social media is also a big part of this too, and I really try and limit how much I'm looking at social media, even though that social connection is really important, and I want to stay in touch with friends and family. Some of the bigger, like scrolling through Facebook, for instance, perhaps isn't the most helpful thing.
Yeah. So another part of this that it might be helpful to recognize is that it's not only is there increased stress, but our normal coping activities or things that we do to ground ourselves or sustain ourselves, we might have limited access to. So things like going to the gym or going shopping or being out in the world that sustain us, that make us feel nourished, or that make us feel grounded, we're not able to do. So it's kind of like a double whammy, where we're kind of not able to do the things that we might normally do to feel good about ourselves, and there is all this additional stress. And I, just to acknowledge too that no one's ever been through anything like this. And so we have no prior experience. And so typically our minds are very good at whatever we're encountering, using its prior information to help inform us. And so it's going back to look and see, well, what can I compare this to? And there's not much there. And so that can provoke even more sort of uncertainty and anxiety and confusion about what's going on. Like, what some folks might even not know, what's the appropriate level of anxiety? Should I be freaking out? Is it okay that I don't feel anxiety, or maybe I feel quite comfortable being in my home? And there's also I hear a lot of folks, and I can relate myself too, that sometimes when if we're alone at home, we might be spending more time with our minds. And if you are someone with anxiety or has a tendency to worry or a tendency to have negative thoughts, you might be experiencing more of those.
Mm-hmm. Yeah, that's actually where I find that a lot of my difficulties have been is just being alone with my phone or computer, not really being able to kind of hash out thoughts and just kind of letting it brew. And I think that people who have anxiety may tend towards that already, so it becomes even more kind of strengthened, and it more maybe I guess it becomes worse and more like have a negative impact on them. Like maybe thoughts that were once more kind of realistic become more kind of magnified and distorted after you go over it again and again. So I think that's something to watch out for. Mm-hmm.
Yeah.
Yeah.
And for some folks, this situation might have certain elements that really key into their own type of anxiety. So thinking about individuals with health illness concerns, or concerns about getting sick or others getting sick, this situation might be really kind of suited for your own anxiety. And unfortunately, therefore, you might be experiencing a really elevated level. And I think one thing that we want to do is we want to normalize that if you're having any relapse in symptoms or any increase in anxiety, that's normal. It's a normal response to the situation. So let's say that you've maybe felt like you've worked on your anxiety in the past, and you felt, oh, well, I've been doing fine. I haven't had a lot of those thoughts, or I haven't had panic symptoms. I haven't had obsessions. And then all of a sudden they're showing up. Just to sort of know that can happen. It doesn't happen in every single case, but when it does, to not try to react to it with additional anxiety or kind of freaking out. just to sort of know, you're like, yeah, I'm under stress. And when we're under stress, we kind of go to maybe some older ways of thinking or bad habits or things like that. And that can be really difficult.
Mm-hmm. Yeah.
Yeah, I think it's really important to be like kind and gentle with ourselves right now, maybe more than we normally would. The pace of life is slower, which is actually is helpful for being more kind and gentle. So I think that's been a kind of a silver lining, is that we're getting experience of being in a like a more kind of low key, lower intensity pace of life, and maybe that'll help. Maybe that's a good opportunity to help people like tap into their kind and gentle, maybe compassionate practice to kind of learn some skills in that area if they want to become better at that. This is a good time for that.
Yeah. So one last thing I'll say, or maybe two more things, just about why this situation might be causing a lot of anxiety or distress. Is that this is anxiety is a normal response. Stress, our response to something that's dangerous is anxiety, and in this situation there is some danger. And I think we want to be cautious. Like, anxiety is helpful in that way. It helps us mobilize our resources to protect ourselves. And, I think one of the things that can be difficult is getting a sense of what is the actual danger here? How much do I need to be worried? And what are the things that I need to be doing? So, having increased anxiety is not necessarily a bad thing. Most of us don't like our anxiety, and we think of it as our enemy or something we want to get rid of. But really, it's trying to help us. It's trying to help us survive and protect ourselves. And sometimes if we can see it that way, it can be a little bit helpful to tolerate.
Mm-hmm.
And that also, everyone is coping differently. So I've talked to some people who are actually really enjoying being at home and really enjoying not having social obligations and pressure to do things, and almost feeling guilty because they feel good, and they know other people are suffering or struggling, and it feels weird to them. And so just when we might say to someone who's grieving that everyone has their own process, here too, whatever your reaction is, however you're responding to the situation, to try to allow yourself to have that individualized experience and not judge it or compare it too much to other people. It could be challenging if people in your household are coping with different styles, but to kind of recognize that there's no right way to cope with this, or there's no good or bad way. It's just we're all kind of responding based on our own history.
Mm-hmm.
So anything that either of you might add just to help kind of make clear why this could be so anxiety producing, or why we might be having increases in distress?
Mm-hmm.
So let's then
Yeah,
go ahead.
I do have a thought there. I've been talking to a lot of people and just thinking about like how a lot of us are grieving over the way of life that we had, and it's that grieving process seems to be ongoing, because unlike maybe a death of a loved one or something that is more certain, like where it's already passed, this is like ongoing, and it seems to be like day by day, because maybe like in the summertime, for instance, we would normally go swimming, and I don't know if we'll be able to do that anymore, or go to the park, to the playground, and we can't do that right now. So it's like every day you go through your routine and you're like, oh, well, I can't do that anymore. And it just it keeps adding up. And I think that's something to watch for, is that grieving process is something to make room for, and like provide a space to be gentle, to like reflect on, this is hard, that this is really sad and difficult, and just allow yourself to be sad about it, I think. And I know that if you resist doing that, it probably will feel like it will come up in different ways that you don't expect. So it's important to kind of maybe intentionally, like when you notice it come up, intentionally tap into it and reflect on it. That's just something I've been noticing personally.
Yeah, thank you. It's really important. I think that there is a lot of loss, and yeah, allowing ourselves to be sad about that, and to have feelings about that. Yeah. So let's transition to talk a little bit about our perspective on what might be helpful in coping with this. I think there's a lot of resources out there. You might be overwhelmed with coping tips and things of that nature, but we thought we'd just offer some perspective about things that we think might be helpful, especially for folks who tend to struggle with anxiety. So
Yeah. Well, a lot of companies are providing free resources right now. I wish I was taking notes and like making a list of them as I learn about them, but I've been learning about it just from word of mouth. Like Amazon's offering free resources to kids, like they're lifting the subscription. Headspace is offering free subscription to healthcare providers for their services. Audible as well. So there's a lot of like resources out there. Maybe that can be overwhelming too, but I think if there's something you find that you're needing more of, maybe seeing if there is a free resource or something low cost for you to tap into. And also I've heard a lot of therapists as well as our clinic are offering telehealth services and reduced fees for this time because, well, first of all, we can't meet in person, so telehealth is necessary, but also because there's a need for reduced cost services since a lot of people are losing their jobs or reducing their income during this time. So that's something to know about.
So asking for help is I think if you're feeling that you're struggling, that reach out to somebody, reach out to a friend or a family member or a professional, a provider you work with, or finding a new provider. And I think one thing that for me is really helpful is not putting pressure on yourself to accomplish a lot or to make the most of this situation. So you'll see a lot of, I've seen a lot of things on social media about, thriving and having, coming out of this, mastering a new language, or learning a new sport. And if that works for you, that's really awesome. That's great. Definitely go for it. That can provide purpose and meaning. You might find activities that you didn't look into before that you're now looking into. But I think for some folks that can feel like we're just trying to get by, like we're just trying to survive and get by day to day. And so the idea of like making the most of this is maybe not so helpful for everybody. I know for myself, some days I'm just trying to kind of do the basics. And I had gone into this thinking that I was going to accomplish these things I didn't have time to get to. I had this idea I'd have all this extra free time just because I was at home. But actually, because of the situation, I find myself more tired and having less resources. So in the end, at least so far, it's not feeling like I have all that much more time.
Yeah, I think the other thing too is, at least for me, I experience sort of both things, right? So some days I really feel like going for stuff and being productive, and that works one day, and the next day, I'm kind of more in let me get through this day and survival mode. And I think both of those things can be happening for people at the same time, and it may be day by day or week by week, or it may sort of change over time too.
Mm-hmm.
I also wanted to add to reaching out for help. I think a lot of people in this time maybe feel it can feel like, well, everybody's struggling. I don't want to put that burden on somebody else. But I think, the thing is when you reach out for help from someone else, that's really validating for the other person, because chances are, they are struggling too, and you can be sort of the point person for each other. And so I think, as hard as it is sometimes to kind of work through that, I don't want to be a burden, or I don't want to be an extra stress. I think um, most of the time it really isn't for somebody else.
Yeah. And that's a good point. I think, in some ways, knowing that we're all going through this can be helpful, but we shouldn't use that to invalidate our own distress or to minimize what we're feeling. And so, yeah, other people might be struggling too. And we forget that actually when we ask for help for somebody, we're also giving somebody the opportunity to take care of us, which might be helpful to them and usually increases connection.
Mm-hmm.
I think
One thing that I've seen a lot of people write about, and I think it's a really good suggestion also, is maintaining some kind of schedule.
Mm-hmm.
But I think, and I think that's really important, because it provides structure to your day. It provides some consistency, which we need in a time where a lot of things are outside of our control. There's a lot of uncertainty. At the same time, I'll say that I started this off with a really great schedule that was going to lead to like lots of productivity, and every hour was scheduled, um, and probably within day 2 I had completely gone off the schedule, and now my schedule is sort of like, it helped me identify the things that are important to me and the things that I really want to have be a part of my life. But in terms of following like a really rigid schedule, that didn't work for me. It might work for some people, and that's awesome. But if you're finding that following a rigid schedule doesn't work for you, I think that's okay too.
Mm-hmm.
Yeah.
Yeah, I agree. Yeah, maybe just having like your like, important activities that you want to do every day, and just checking it off, like taking a walk or cooking a nice meal, just, things that you want to do regularly, but not having it be too rigid, because that is, on rigidity on top of all the stress you're going through probably isn't helping. Mm-hmm.
So one of the words that us therapists use a lot is flexibility. And so that's having flexibility that's what I'm hearing from you. And it's such a great concept now, is that we can be flexible. Like, I'll try to make a schedule, and if it doesn't work, maybe I'll try something else, or maybe one day it makes sense and it's helpful, and another day it's not. So we can try to be flexible with ourselves, because the situation is also changing so rapidly. I think for folks with anxiety, especially folks who've been through treatment, odds are you've learned some skills or some principles that have worked for you in the past. So just to take some time to think about that, and to identify what's worked for you in the past, and maybe to go back to some of those things that might be a little rusty. And in some ways, you might have an edge on folks who maybe not learned skills or been forced to deal with anxiety, who now all of a sudden are having anxiety. So seeing the fact that you've had anxiety and you've learned some things for it as a strength, and to maybe go back to what's worked.
Mm-hmm. Yeah, I think one thing that can be tricky about the situation is because it's a brand new situation that none of us have experienced before, it can feel like, oh my gosh, I have no idea how to handle this. But if you have been through treatment before for anxiety, or even if you haven't, the same coping skills that have worked for you in the past will likely work for this situation too. It's just, it's a different situation, but the feelings are similar in a lot of ways. And so a lot of similar things are going to be helpful.
Yeah.
Yeah, I mean, I think of it as the analogy of like a marathon, in this is like a marathon. I'm not sure if it's going to be 26 miles is actually an ongoing marathon. We don't know when it's going to end, right? And that's actually the really difficult part of it. But thinking about what people do to train for a marathon, to get through the marathon, like there's a lot of pain and suffering that goes into actually going through the marathon. I feel like our I guess the only thing we can do is just kind of keep going and focusing on a goal or a value that we want to live out, and maybe that'll help us kind of go day by day, even though there's a lot of difficult stuff that we go through every day during this marathon. So maybe identifying a value that's really important to you for why you want to, keep going, and what you want to get out of every day might kind of help go through this day by day process.
Yeah, that's great. Just to add to that about values is that, a situation like this can often put things in different perspective and make clear to us what's most important. And so this might not be helpful for everybody, but connecting with what's really important to you in your life as you try to navigate the situation. I think one version of that is to see that staying home is a very active choice. Your sacrifice to stay home and to give up activities is a tremendous contribution to the greater good. And so it can often feel like we're doing nothing, but to sort of remember that we are doing something pretty important. That might be an example of using a values-based approach to help us understand what help us make more meaning out of what's happening. And so another sort of tip, you'll see a lot of people writing about, or if you on social media about, moving, like the basics, like sleep, exercise, eating well. I think I'm failing at all three of those. But those are things I am trying to work on. So I know for myself, like when I'm stressed, those kind of self-care activities are the first things to go. So I try to put extra effort into making sure that I'm taking care of myself and my body and my physical needs, which can be very easy to overlook. So this may not be helpful for everyone, but your bar might be different. So my expectation of what taking my care of myself normally versus now may be different, but I can still see that I'm putting effort into it, and I am still doing things that are in the spirit of taking care of myself.
Yeah, I think that kind of goes back to not comparing yourself with others, like through social media. I think, Juliana, you mentioned that, like, you're trying to stay a little bit more, like, not to go to social media as much. And I think sometimes when we're on social media, we're watching everyone do what they're doing and their amazing projects or accomplishing new things and seeming like they're dealing with it really well. So I think, yeah, it's like kind of figuring out what your bar is, like what would make you feel satisfied and proud of yourself if no one else was looking. I think that's a good way to like figure out what your true value is in this moment.
Right, absolutely. I think with social media, it can be easy to feel like everybody's, either feeling one way or the other, and let it kind of guide, like, oh, maybe I should be feeling this way, or I should be doing, I should be baking bread because that's like what everyone's doing right now. I should be doing yoga, those kinds of things. And there is no, should be doing X. What you need to do what you need to do to take care of yourself, and that looks a lot different for different people.
Yeah.
And I mentioned this earlier, but just to emphasize, to allow joy or to allow positive emotion into our experience when it's there, and not feel guilty about it, or not try to like inhibit it. Like if we're enjoying being at home, or if we're enjoying something, that we really allow ourselves to take it in, and not sort of filter that out as some of us might tend to do. It's okay to feel that way.
Hmm. Yeah.
Okay. Any other points or things that either of you would like to say?
Yeah, I mean, something I work with my clients on a lot is because they have to face their fears in the treatment that I do, is to sort of change their perspective on it. It's like instead of feeling like they need to white knuckle through something, or they have to kind of like just get through it because it's so hard and so scary, maybe thinking of it as like, like this is a challenge and an opportunity to learn and grow, instead of like this is a scary thing that I'm doing. That switch is like very subtle, but just kind of switching it to like maybe like a bring it on, like, you know, come on, COVID-19, bring me everything you have, and I'll 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 take this challenge to be my best self. Um, it can kind of orient your mind differently around the whole thing. So that's something to think about. Kind of like a roller coaster analogy. If you're on a roller coaster, you're gonna feel like uncomfortable feelings. Your stomach's gonna drop. It's gonna be tense while you're going up, but you do it because it's also gonna give you this thrill and pleasure. And so it's like a kind of a mixed combination of feelings, but focusing more on the pleasure and the thrill instead of the stomach dropping and the anxiety of the experience. So that's just my 2 cents about that.
So I wanted to end by just acknowledging how hard the situation can be for us, and to think, so we sort of offered a bunch of different options or principles. And again, they might not all be helpful or resonate with you. And some might resonate on some days more than others. So I'd encourage you at the end of this video, when it's over, to maybe write down 1 or 2 things that you found helpful, or something that you'd like to try over the next couple of days, just to help you kind of remember and take it forward. If you have any questions, you can feel free to follow up with us. Again, we're at Portland Psychotherapy. The website is portlandpsychotherapy.com. You can find our information there, our email. But we wish you and your families well during this time. And we might put up some other resources in the future, so stay tuned. And thank you all for watching.